Hello, everyone. Thanks so much for joining us on Knowledge of Nonsense. My name is Sharon Combs with UCDI Leadership. I'm a certified human behavior consultant, and I'm just an all-around how do we help people type of person. Today, we're going to answer some questions from the community, things about how can we best protect ourselves. We're going to talk about some topics of awareness, and we're going to give you some tidbits so that you can do the best you can do to position yourself as we're coming out of these stay-in-place shelters and these movement restrictions so that we remain healthy. Please ask any questions you may have, and we're just going to jump right into the conversation. I have with us Luane Perkins. You guys are familiar with him, and Lila Price, subject matter experts in sterilization. We're also joined by Kiana Williams, a nurse out of the Louisiana area, Naima Fletcher, someone who can help us with immunity, a holistic coach, and Raven Williams. Raven's going to help us with awareness. Somewhere we believe that it may not hit people with melanin, or it's only for older people, and that's not the case. It's not a hoax, people. It's really happening. It's really going down, and we want to be sure that us, our loved ones, our communities, and our extended spheres of influence have what they need to best navigate where we are in this pandemic and as we're transitioning. All right, so thanks everyone for being in today. I just kind of wanted to start, if possible. I wanted to start with you, Kiana, if it's possible. What are some of the things, I don't want to say that you've seen, but if you had to try to help people be aware of this, what are some of the ways that you might tell people, hey, it's not a joke. People really get sick. I think you have felt you went through some symptoms, right?
Yes, I did. Actually, I began having symptoms around March 20th. And here in Louisiana at that time, everything was still, it was moving pretty quickly. However, the awareness and the number of cases hadn't really, rose to a certain amount. So I began feeling sick while at work, probably the day before, but I brought it to their attention the next day. And then I was sent to employee health. And once there, I was sent to urgent care that's affiliated with the hospital. But I was denied the test at the time because even though I had a temperature and they ruled out the flu, because that was in the beginning, that was the first day, they had to rule out the flu. I just didn't have enough symptoms, nor did they have enough tests at that time to test me. So I was told to go home and pretty much just monitor my symptoms. So in between that time, I had to call daily and let them know what was going on. If I had a temperature or body aches or anything, and follow up with them. 2 weeks later is when they decided, oh, this would be a good time to test her. Well, my test came back negative. That was 2 weeks later after. And the thing about it is, once you're tested for the virus at that time, they were not testing for antibodies. So at that time, I probably wasn't actively, with the virus. However, that was the circumstances surrounding. So it's not a hoax. I know people that have, been directly affected. I know people who have lost their lives. And I know coworkers who have been hospitalized and intubated. So it's not a hoax. It's not limited to one person of one particular gender or demographic. It is everyone should take precaution.
Okay. Excellent. Excellent. So 2 weeks, and that's just because of the testing at that time, right?
Correct.
So it is possible for someone to be having symptoms and not be able to be tested. Is that correct?
That is correct.
Okay. I know I had a, go ahead, Dwayne. You had a question. You had something.
Well, not a question because Kiona, there's been a recent news article about a Detroit healthcare worker who was tested 4 times at the hospital she works at, but denied. And unfortunately, this young lady succumbed to the illness. So your story resonates with many people. We have staff members and colleagues that work with this young lady in her facility, and her symptoms varied. You know, she also had a fever at one point. She was also concerned for her health, which is why she took the immediate approach to use the hospital's facilities to get tested, the ER, but she was denied. So your story, once again, is resonating within many communities. So thanks for sharing that.
You're welcome.
Thanks for sharing. That's going to lead me to a segue over here to Raven. Raven is with us, and Raven is a senior in high school. She's in a region that's near my region. And last week, again, I just want everyone to be aware, because I know myself, I've talked to people who are younger, even in their 20s, and they're like, yeah, well, that's not me. Like they literally, and they're not even trying to be disrespectful. It's just like, if you don't see it, you don't see it. If it's not real, it's not real. And so Raven has been so kind to come on and share just someone that she's in proximity with who was also a teenager. So Raven, I'm just going to let you share a little bit about your story and why you want awareness to come. Like, why are you telling people to be aware?
I want people to be aware because of the fact that you would never think that this could be me. And I don't know, you really don't ever think that it can be you until it actually happens to you. And it's heartbreaking to know that it happens around you and that it could be you at any point,
Okay. So with you, can I go ahead? Can I share that someone within your age bracket close to you, that they actually passed away this week? Is that correct? This past Tuesday. And I know that they were coughing the Friday before, and then they passed away this Tuesday. So before that happened, before the person passed, how serious was this COVID to you?
Honestly, it really wasn't that serious to me. I did go out in mask and gloves because I was like, I have asthma, so I don't want to catch anything just in case it is like real. Until it happened, it really wasn't that serious to me. I was just like, okay, well, it's just like the flu, or it's just like a common cold. So,
okay. All right. Excellent. Thank you. Thank you so much. We'll come back to some more questions.
Well, I have a question for Raven.
Let's do it.
So Raven, before you got on, we were just talking about, we have some, all have high school seniors, right? Many of us on this call who are about to enter college. And my son is 17, and that age, his age and some of his friends, you get mixed responses. Some are taking this seriously, but the majority are not, and I think they're feeding from our early information that was only impactful on older people. So I appreciate your statement coming from your age bracket. And again, the message that you're sending out, I wanted to ring loud and clear to folks who in your age group. What was it, the tragedy that you were a part of that made you take this serious? Was that the moment that you said, this is real?
It was, because it was heartbreaking, like we had just talked, and it's just like, wow, like I would never think that somebody this close to me would be gone because of COVID.
How old was your friend or colleague, if you don't mind me asking? 17 years old.
Mm.
Like, so our condolences to you and her family. That's really tragedy. But in these moments of pain, our hope is that our communities can learn a valuable lesson. If you had to share a message with folks your age about COVID-19, what would that message be?
Don't take it as a joke. Yeah, it's made like everything around us be hard, but it's not a joke. It's not a prank. It's not just to get us to stay in. It's not just to take all of our prom and graduation and cotillions and everything away, but it's to keep you safe. So stay in the house. um, Stay away from people. Only go to the stores when you need to. If you know you have like asthma, I have friends that have diabetes. If you know you have underlying conditions, stay away from people.
Mm.
Um, and I appreciate that. Thank you for sharing that because it is not a joke. And here in Texas, they like open some things up, like I don't know. I get that people need to get out, but like even like movie theaters, and they're like, well, just have it at 25% capacity. And that's why I really wanted us to do this, because even though they're opening things up, the economy demands that stuff opens up. In layman's terms, so people feel like, hey, we need to go to work. We have bills. And I get that. And it may not be in Nebraska, may not have the same effect as it has in New York City or in Maryland or Boston as in California or Arizona. But here they're relaxing these restrictions. But COVID, not to be honest, like COVID is still prevalent. It's still in these streets, y'all. It is still in these streets. Like, stop playing. In Texas, our cases have not gone down for 2 weeks, as the CDC recommends, as the powers that be recommends before we open up. But we're still opening up, and we want people to be aware. And so what we're going to do right now, we're going to talk a little bit about sterilization and again about aerosols. I know I hit this Tuesday and Thursday, but I want to hit it again because there may be some other people, some other audience members. Aerosols are invisible to the naked eye. Like, you cannot see them. It's not just pledge. It's not just what you use to dust or what people used to use for deodorant or hairspray in the 80s. Aerosol is a real thing that you cannot see. And that's why you want a mask, and you want an effective mask. Listen, I know it's a whole lot of people selling masks on Facebook. Get your money on. But for those of you who are buying it, if there's not a filter in that mask, it has 0%. There's 0% protection against a virus. Don't be mad at me. I'm just putting it out there. And so before we go to our next commercial break, Lila, LaWayne, Naima, if you guys could just say like maybe one or two things that someone could do in the community to just kind of be like, hey, this strengthens my this gives me a little more protection. This puts me in a little better position, whether it's taking off your shoes when you walk in the house, like whatever it is. Go ahead, guys.
I would say first, I would think of, wash your hands. I know that, we can't stress it enough, but if anything, I keep repeatedly hearing from my infection prevention people from work is just that, even with these instituting the mask and people wearing them, washing your hands is very acceptable. You have to make sure that you don't touch things and continue to keep passing and cross-contaminating areas where you could have picked up the virus, and therefore pick it up and then transfer it to yourself through a mucous membrane by touching your face, your eyes, mouth, all those things. So being cautious and just conscious of what you do, your next moves. So washing your hands, I would say, is probably the biggest thing for me. If I could tell anyone to do anything, wash your hands more repeatedly, everything you touch in the house, and even outside. Wiping down surfaces, those disinfectants, those are things that are real. Those are things you can control and help. So, just don't go outside and grab a cart and not realize that I need to wipe it down. Or as I'm walking around the store with my gloves on, which is a pet peeve of mine, I do not like that practice, but being cautious of the fact you're touching something, and then if you put it back, being courteous to the people who are around you of maybe wiping it off with something else, because you now cross-contaminated with the meat products that you may have touched 5 minutes ago, and not realizing that you keeping these gloves on is also just spreading bacteria and other things around. So we're all scared of coronavirus right now, but there's also other viruses that we can spread with this, with cross-contamination and things of that nature. So being conscious of everything and people around us and being concerned for those around us. So washing your hands, protecting yourself will be what I would say would help eliminate some of the spread of this virus.
Okay.
Naima?
Yes, I would say eat foods that are immunity boosting, and not to be in such a state of fear and anxiety and worry. Our bodies do have the innate ability to heal themselves, but we also have to give them an opportunity to. We have to nourish it with nourishing foods, herbs, vitamins, supplements, fresh air, meditation, breath work. All those things are important to your overall well-being. So my advice would be to eat as many fresh fruits and nuts, seeds, all those immunity boosting superfoods that will help our bodies to heal and to fight off viruses like coronavirus. And this is not to say that we won't be affected by it, or we make ourselves, won't get it, that we won't get it. It's not to say that we won't get it, but if we have a strong immune system, we give our bodies the best chance of fighting off viruses like corona. Yeah. So you set yourself up for success, and we don't allow viruses like corona to take us down. So it will go through our bodies. If we have a strong immune system, viruses like corona is only going to stay in our system maybe 5-7 days, and then it'll pass because your immune system is so strong. So superfoods like raw garlic, putting those things in your salad, turmeric, cinnamon, nutmeg, cardamom, all those chai spices, all those warming spices. The idea is to warm the heart and the lungs and to help viruses and bacteria just move through your system.
That's good.
My advice would be to use your pantry staples to create, tea, herbal blends. You can just boil ginger and cinnamon together for a half hour and sip on that. Those are warming spices. And in conjunction, they are really powerful superfoods.
That's excellent. Excellent. Lawayne, you have anything you want to add before we go and pay a couple of sponsors?
Well, quickly, just continue to educate yourself. Lala brought up an amazing point about cross-contamination. I'm seeing this everywhere. Folks reusing single-use masks over and over and over again without any decontamination, any a possibility to kill the germs already on those masks. And I urge everyone to look at this amazing study from MIT about pathogenic droplets, how far these air particles when you cough and sneeze can travel up to it's amazing. It's mind blowing. So
25 feet.
Yeah, 25 feet or more. And MIT did a moving study that they using high-tech cameras, you can actually see the particles traveling in the air. So that please check that out. And Naima, thank you for that amazing health information. I think I can spend a whole show just about that. So Sharon, is back to you. Thank you.
All right, great. We're gonna pay a sponsor. We'll be out for maybe about like 30 or 45 seconds. And Naima, I definitely want to ask you about breath work a little later on. Gonna come back to you, Raven. And I definitely too want Keon, I want to share a little bit because you are an author as well. And so even what she was saying about stress and meditation, not getting that in there. Like I know that you have a book that you've written about that. And so we'll talk about some of those things because again, we want to give people tools. Guys out there, if you have any questions, I see we have a few viewers watching. If you have any questions, ask your questions. This is the time, we're like, well, maybe it's fake media. No, ask your questions because we're in different regions. We're not all in the same state. We're not all in the same room, and I want you to know this is going to hit certain communities more than others as things fizzle down, not even just because of our natural affect, but because of just disparities in other things. And you may not get the information till too late. And right now we have people here who can help give information, give tips, give tidbits to help protect you and your family. It's not a joke. They're opening up. And again, we have to do our due diligence to take care of ourselves. We have to do what we can do to make sure we're in that fighting position Naima was talking about. So we'll be right back in a few moments. All right, excellent. Hey, I was able to go and I was looking up some questions that you all probably can't see right now, but there's a question on here about a bullet. That's a really good question. We're going to come back to that. One of the questions is, beyond demographics, the immune system is a common denominator. And they say, how can one improve their immunity? And so, Naima, you just hit that. Thank you so much. And more than prevention, what self-steps can a person take if testing is denied, if testing is negative, or if symptoms are minor to save themselves? So I'm going to repeat that. Like, when testing is denied, because I know here in where I am in the Dallas-Fort Worth area, if you don't have a certain amount of symptoms, you can't even go and get the test. And I get why they're doing that, but at the same time, then you're still going to be infecting other people and maybe getting worse.
Right.
Because you're waiting, like, well, you're not at death's door yet. Come back later. And it's different here than it is in New York. Here, we still have capacity. We're not running out of ventilators here at this time. And so what steps can a person take if testing is denied or if testing is negative, like to save themselves? The symptoms are minor. So what are some things we would recommend? And I understand, guys, these are recommendations. I just have to do a disclaimer for UCDI. These are subject matter experts, but still, since we're not your actual physicians, I want there to be a disclaimer that you do want to also talk with your doctor, the people who are entrusted with your care specifically.
Well, Sharon, I can share that there's a doctor out of Queens, New York, and that he shared some breathing techniques that went viral, and I'll send you the link. He shared these breathing techniques with folks like Chris Cuomo, the news anchor, the author J.K. Rowling. She reposted it several times. Just some amazing breathing techniques that you can do before you're infected, during infection, to really strengthen your breathing apparatus and lungs. But I would love to hear from our nurse today to see and our nutritionist, herbal nutritionist, to find out more from that aspect. But I'll share the video from the doctor from Queens, New York, that you can post to our followers.
All right.
Excellent. As Luann mentioned, breathing techniques as well as doing things to boost your immunity. One of the things that we overlook is simple monitoring. That's one of the things I was doing. Once I was sent home, I continued to monitor my temperature myself. I continued to increase my fluids, mostly warm fluids. I stayed on top of, getting adequate rest. We take that for granted. We think we can just keep run ourselves into the ground, basically, and not do anything about restoration and restoring. Just overall, monitoring my symptoms, eating, being aware of how I felt. And I even told family members as well as friends, a lot of times we go to the doctor when it's like really, really bad. But any alteration in your breathing pattern, any alteration in the way you're inhaling, exhaling, that it doesn't necessarily have to be pain, but that's not your normal way of breathing. You have to be aware of the best, the best person that can tell you about a patient is their self. And when you notice something is off and different, you have to go back. That's one of the things. I know they denied you and told you to, go home and rest. But when you notice something, even your family members, you notice something that is out of order, they're breathing differently. They're not their self. They're not easily aroused. We can't wait to the last minute, because once we get there, a lot of times it's too late. So for me, I continue to monitor myself, my symptoms. I was aware of how I was feeling. Just increase my fluids and, got rest, because that was one of the things my body was lacking.
Okay. Excellent, guys. I have so many questions. So what I'm going to do, if it's okay with you all, can we answer some questions? Are we game to answer questions?
Absolutely.
This is from Broken Arrow, Oklahoma. We have people from Broken Arrow, Oklahoma, Florida, sunny Orlando, Florida, Oklahoma City, Dallas, Texas, DeSoto, Texas. One of them is And I'm just going to hand these out. So why do they say 6 feet? I'm going to give that one to you, Lila. Hold it. There's more. What's another one? Raven, are the youth in your area taking it serious now? But hold it, because there's more questions. So now that I'm coming with these questions, please provide filter examples for masks. I will share some things. Again, innovative ways that people have done it. Even in my church, a lady in my church, I was like, that's a great idea. Another one is like, do the young people even look at the news? Now that's a good question, but you know that's an adult that asked that question. Like, I'm so worried about it. I'm like, are you even paying attention to what's going on? You know, like maybe they do, maybe they're on Snap, but you know what? That's why we're doing things like this so people can get these answers. And so, all right, why do they even say 6 feet? That's you, Lila. Why do they say 6 feet?
So real quick, you just need to make sure that you're a distance away from someone so that if they are exhibiting some type of symptoms, or even if they're not exhibiting symptoms, so they could be asymptomatic, right? We want to make sure that we're allowing us to have that space in order for, if there are some aerosols, a sneeze, a cough, something is coming from emitting from their body, that we're not allowing ourselves to be exposed to it. You know, I go beyond that with 6 feet. Like I'm a little 10 feet, 4 feet. I love the fact that every grocery store I go into or wherever has those little markers so that I'm being conscious of where I need to stand in relation to other people, because I'm not exhibiting symptoms. I don't feel that I'm sick, but I do not know also. I've not been tested. So I'm doing it to save you from me, as well as you save yourself from me. Like I just want to make sure we're all safe. So because I'm not exhibiting symptoms doesn't mean that I may not exhibit symptoms in the near future. But also being in contact with other people, because now I'm at risk. I'm at a grocery store, right? A public place. They're not monitoring people. They don't know who comes in there that's sick. I don't see anybody giving anybody a temperature probe or anything of that nature at grocery stores at this point in time. So just be mindful that's a safe distance for all of us. I see a lot of people, you know, just being, you kind of see these out of the way things, but I've seen people with hats and all kinds of little different devices on so that they're monitoring their arm's length distance. So, you know, if you can swing around and touch someone, then you're too close. Just as a good reference. But I know it's human nature. We want to be able to help people. You know, someone dropped a package in the grocery store yesterday. I immediately went down, bent over, picked it up for the lady, and handed it to her. And I saw her resistance at first, and I realized it myself that I might be like, ooh, but that's just who I am. So being conscious and everything else. But I was just like, I promise you, I washed my hands before I got here, and I have hand sanitizer right in my purse. And that was the end of it. She laughed, I laughed, and then we moved on. But it's just that human nature. We want to be close to each other. We earn for that type of connection with people. But just do what you have to do to be safe, because we don't know everyone's status, and there isn't any type of stamp on anyone saying positive or negative for COVID-19. So right now we just have to go off the fact that we have to do these things to keep ourselves safe and our families, because we're all going back someplace else after this, and we're going to be interacting with other people that are close to us. So if everyone was sick, kept touching other people, we'd all have it eventually at some point in time. So social distancing is important. 6 feet of distance at least, if not more. Try your best to practice those things appropriately.
Excellent. Naima, are the young people taking it serious now? And do young people even, oh no, not Naima, Raven. And do young people even watch the news? Are y'all taking it serious? Well, I know you are, love. But
I know now, at least the people that like are around me, we're taking it pretty serious because of the fact that we've already lost somebody. But when the question came up, we watched the news. I feel like the news is stressful. So we normally just get stuff off of social media.
Deep. That's interesting. Now I've heard that before, even from my own young mind. So thanks for sharing that.
Oh, I missed it. What did she say? Will you repeat it?
I said after losing someone, it's become like more real to us. But watching the news, we get everything off of social media. So
yes, and even though I know a lot of young people are like, Facebook is old and out of it, I'm very glad that at least we're able to do this, and it does stream to YouTube too. So, you know, cut it up, repackage it, repurpose it, whatever, but let's make people aware. Naima and Kiona, I'm going to let you guys weigh in on this. Somebody said work versus safety. And so as a primary caregiver too, how do you weigh going to work versus, especially if you have people within your sphere that may have compromised immune systems, or how do you weigh, I got to go to work, but I don't want to do this. So work versus safety, like what are some methods? And there's no one method, everyone. There's no one method. We're not saying this is the only way, but what are some things that go through the process of vetting that, like of deciding, oh, I got to go to work. No, maybe I need to call out sick a couple more days. Hold on, the office is open. Can I still work remote? Like, what are some things that work versus safety? What are some tangible questions or things that we can think of when we're making that decision so that we don't have to just make it in panic mode?
Well, I think it's important to think about your safety first. I also work in a restaurant industry, so my job was not a necessity. So we were closed down almost immediately. So that I didn't have to think about whether or not I was going to go into my job. I still do, my health coaching, but that's something that I have always done just, virtually. So that was okay for me. But if I was in a position where I had to think about whether or not I wanted to, if I had to go to work or if I had to be safe, well, I have to keep myself and my family safe first. And unfortunately, I know that there's a lot of people that live paycheck to paycheck and don't have any money saved. But we also have to keep in mind that if you're not around, what difference is it going to make if your bills aren't paid? You have to communicate with your creditors, your landlord, your mortgage companies. Right. Everyone is aware of what's going on. Everyone is in the same position. We are all being affected by this. Communicate with them and say, look, I can pay this and this is what I have. This is all I have. So we have to think about our safety first.
I agree. Safety is definitely first. With myself as a single parent, I have a 17-year-old who has illness that compromises his immune system. So when, at the time when I was reporting to work, going in daily, that was always a concern of mine. What am I bringing home to my family? While I was at work, one of the things I did do was once I get home, those clothes I have on, those shoes stay out. The clothes go immediately in the washing machine, which is something everyone else can do when going to the grocery stores as well, because I do that too. When I go to the grocery store, I do not sit, when I come back home, I do not sit on anything. I do not, have a seat on the sofa and all those different things. Those clothes immediately goes into the washing machine, but that was a decision I had to make as well. Because honestly, in my industry, again, I work in the OR the bulk of the time. A lot of times they put the OR elective cases on hold. So they were actually deploying them to other units. And that's a lot of things that, that's a whole different subject where nurses face the actual issue of going to work in areas that they're not familiar with. And so a lot of people think a nurse is a nurse is a nurse, and that's not true. So they had to come to terms with whether or not, they're actually given safe care. So that was another issue. But for myself, I had to make the decision to protect myself and my family, and work on other things that I have going on.
Very interesting.
Yes.
Hey, Sharon.
I want to interject right quick, and then Luane, I'm coming to you because you're going to tell us about aerosols, and I have some more questions about the surgical mask, the filters. What's the difference? I'm going to ask them all to you, and you can just answer as you see fit. If we miss it, we'll put an answer in later. I just want to take this moment right here and say thanks. The studies that I do in my field of expertise has to do with emotional intelligence and transition stages, and so definitely for you, Raven, for you, Naima. For everyone who's inside of this, there are going to be these things that are called stages of transition where you're going to go through certain emotions. Listen, don't freak out over the emotion. I'm just going to use layman terms. Don't allow those emotions to unseat you. Feel the emotions, process the emotions, but keep moving. Don't get stuck in one emotion and feel like this is it. No, this is just a process. These are stages of transition. So, and transition feels like falling, right? It feels like you're falling, and when people fall, they reach out to stabilize. In this case, just lean forward. stay aware, make yourself aware, take assessments of where you are, but keep leaning forward so that you can, because we're going to transition out of this. Just like they're opening up places now, we're going to transition out of this. And so for you, Raven, you're going, baby, I'm so sorry. I'm so sorry. I'm sorry for everyone who's lost someone, but I'm so sorry because at this point in your life, there's going to be something in your mind that says, this isn't supposed to happen. And you're going to have to navigate, this isn't supposed to happen, with the fact that this did happen. And so there are going to be some emotions that you go through, you and your friends and the people around you. And I know people are asking you questions. So I'm just trying to give you a little tools, you know, stay in your faith, but I'm trying to give you a little tools to be like, it's okay. It's okay to be frustrated. It's okay to be angry. It's okay to cry. It's okay to be confused, bewildered, uncertain. And it's even okay to feel a little depressed. Don't feel like you have to run the other way. Don't stay there. You know, feel it, express it, you know, just be like, wow, that's part of life. And again, I'm sorry, because I know in your mind, it's like, this isn't supposed to happen. Wait a minute. And then you begin to think about all the injustices. Like in the case of your friend, I know there was a parent that went several times because of some symptoms, and there was some things that kind of were denied. Like the process didn't go well, like it didn't for Kiona. But I just want you to know, and for everybody, listen, we're going to go through these stages, and I just really felt the need to say that the stage is just that. It's just a stage of something. Don't make it permanent. Feel it, cry through it. If it comes back and you're like, I already cried, it's okay, cry again. But still keep moving forward and still keep leaning in, because the stages of transition. And I just want you to know, look, you'll make it through this, okay? We're going to make it through this, but we want to be as prepared as possible. The same way we want to give our immune system a fighting chance, we also want to know that we want to be aware with our emotions, with our everything, a fighting chance. And so now I'm coming back over to you, Dwayne. I know you're ready for your answer. I'm gonna put that link up that you put.
Yes.
Somebody said you alluded to traveling aerosols at 25 feet, and a couple of other people asked, what's the difference between like an N95 and a surgical mask? And here's a key question. Does an N95 have to be fitted to be properly worn?
Ooh.
They ain't ready for the answers, because there are fit tests that people take. So I'm giving all of that to you. And if you guys have something and you notice something you want to say, go ahead and let's just begin to weigh in, because we're 36 minutes in and I still have questions here that I'm not even putting in there.
You had an earlier question about different type of mask at home. So there's a lot of stuff online. You can take a sock. Listen, follow the science. Follow the science. There was researchers out of the University of Chicago that actually did some tests on different materials, and they found out that in order for filtration capabilities of an N95 mask, which filters out 95% of those airborne particles. That's what the 95 is for. But you have to really do your diligence and follow the science that we can't take a sock, go outside, because it's a placebo effect. You think you're doing something safe, but you're really not. I would urge in our community to get involved, begin to petition your local legislators to provide masks to the community that need them most. We see a lot of this in New York City. A lot of our local officials are walking around passing out surgical masks, handing them out, because there's an expense when you need a mask. We don't want to get to the point, team, that you have to now decide, can I buy this bag of carrots or this box of masks? So we have to utilize our internal resources to try to protect those that are most vulnerable. Because it truly does take a village, and that's what this represents. So I wanted to share that with you. I'll post a link for the study out of the University of Chicago. It was listed in the Boston Globe on April 30th. A lot of great research for those who want to follow the science to understand. You just can't take a sock, cut it up in mask. You just can't simply just with a bandana. There's also a new viral video that shows some of our HEPA filters, in your ear vents. Those have been proven to filter out pretty sufficiently close to N95 masks. But again, OSHA mandates that you should be fit tested. the challenge with N95 masks, if they're not worn properly, is pathogens getting in from the side of the mask and do those air channels. So that's the same with mask. That's why you must be fit tested. If it's not worn properly, it's ineffective. And if it's ineffective, you still can carry these harmful pathogens back to your loved ones. And that's when Lala was speaking of cross-contamination. So there's a lot there. I urge you to go to OSHA.gov. They have fit testing policies and procedures, and also hospital guidelines. Another great website that I urge everyone to check out is AHA.com, American Hospital Association.com. They have education on demand webinars. They have a lot of policies and procedures for in hospitals, as well as practices that you can take back to your home.
All right. And just OSHA, for those who don't know, OSHA's the group that looks out for the employees. OSHA's the people that make sure the employees stay safe. You know, there are people who look out for the companies. There are people who look out for the employees. And OSHA is recommending, yes, that you have that fit tested so that it fits to your face, so that it's snug, and so that those pathogens, in this case, the virus or whatever, cannot still get in, or you can't still carry it. I also wanted to say what Kiana said, she doesn't sit down. Listen, things can stay on your clothes 6 to 12 hours. And if you go sit down and you have like a cloth couch or something like that, you sit in it because you, oh my God, I'm so tired. And then you get up and then your son, your daughter, or somebody else come lay and take a nap. Boom. I don't want to make you paranoid, but these are how things can happen sometimes.
Yes.
I can't keep up with these comments, so I can keep up with them. These are some really good comments. And
I just want to add one thing about masks.
Somebody else has something they were going to say.
Real quick, because it's just like I see a lot of people without wearing masks, and they're not covering their nose, like this down here at their mouth, or it's all the way underneath their chin. I don't understand the purpose at that point. If it's not going to be used on your body appropriately, then you're really not creating that barrier that you need. So even with the people who are wearing their own homemade device of a mask or some type of protection, just be cautious that if you're not covering those passages of airways and things of that nature, you're really not doing yourself a service by wearing it, and you're not protecting others and yourself from what possibly could be whatever aerosols are being released into the air around you from other people who may be asymptomatic or actually carry the virus. So just be cautious of what you're doing, because you're really not helping others when you're walking around the grocery store, pulling down your mask constantly, touching the outer part of it, therefore contaminating it as well. So you're making it dirty, and you're therefore holding on to those bacteria and viruses that could have possibly been transmitted from your hand to your mouth area on the outside of your mask. So just be cautious with this mask usage, because a lot of us really are not educated in the proper way to wear a mask and the proper way of putting it on and taking it off. And those things are they come with training, but be aware that, you know, it just takes a second just to tell somebody how to take care of a mask. It really does. You can just tell someone, you know, don't touch the outside of your mask. I've told my children all the time, be cautious of what you're touching and what you're putting on your face and things like that, because they are dirty once we've exposed ourselves to the outside world.
Okay. I'm going to do another commercial break. Our hot seat question today, you can feel free to weigh in, and you can feel free not to. When we come back, this is what I would like for us to do. I am definitely going to share Kiana. I want to share about Kiana's book, because that's a resource you guys can get just to kind of help you deal with the stress. Listen, stop playing. I know there are people like, oh, this ain't bothering me at all. Whatever, stop playing. Every system we have in this country has been shaken. So I don't care, from education to whatever, COVID has affected you. Mm-hmm. Stop playing. Stop playing with yourself. Be honest with yourself. And so I know that book is going to help just with some different things of stress, because if you don't know how to handle stress, you're going to export things onto people around you. And that's not healthy. That's not healthy. You don't have to be perfect, but we want to do our utmost to be healthy. So I definitely want to do
kind of hard for our bodies to heal if we're in a state of stress.
Yes, it's hard for our bodies to heal. Girl, say that again.
It's harder for our bodies to heal if they are in a state of stress.
Because when you're in a state of stress, everything is like, everything is diverted. Even though you think you're cool, you know, you're here, and we need you to.
Yes.
So breathing exercises. definitely too, if you're feeling some type of way within your chest, do the breathing exercises, even if it hurts. My sister went through some things and I was like, oh my gosh, you know, we were in Vegas. She had been in New York and she used to sing and she knew from having pneumonia, she kept doing the breathing exercises. Even though when she got back here, her doctors was like, no, don't come here with the symptoms, right? Where do you go if you don't go to your doctor? Don't come here. They're like, don't come here. So she kept doing those breathing exercises. And I believe it was essential in her making it through this curve. So when we come back, we want to hit that. Naima, I want you to give us some get this, not that, eat this, not that. If you have some of that, like your final tips. And our hot seat question is going to be, this came from DeSoto, Texas. How do you feel about the people protesting so that they can go back to work? And I'm going to add the people protesting in front of the hospitals. Now, we're going to go feed some sponsors. Think about what you say, because this is going out. So, you know, be honest, but be aware that this is in cyberspace and people reach back 17 years. So let's craft our words. But let's be able to say how we feel about that and maybe some alternatives to blocking the hospital entrance. Okay. Yeah, I'll be right back. All right, now can we have some eat this, not that tips?
Buy this, buy that.
Buy this, buy that. Yes.
Okay.
Buy this, not that.
Buy this, not that. Okay, so I wrote down a few that I figured were available to most people. So instead of people buying sodas like ginger ale, maybe buy fresh ginger, make fresh ginger tea, even make fresh ginger tea, cool it, drink it over ice. And then you have a fresh ginger drink that is also going to be immune boosting. It's good for your digestion, and it's good for soothing your digestive tract. Another one, something that's really inexpensive that people can buy and make lots of meals with: oats. So instead of buying prepackaged oats, buy organic rolled oats. The reason why I say organic is because oats have been known to be sprayed with pesticides. The same ingredient that they use in Roundup, it can be found on items like wheat and oats. Those are the two highest, wheat, corn, soy. Those are the highest foods with pesticides. So going back to things that are spread with pesticides, white flour, instead of buying white flour, buy organic. You'll see red wheat flour. It looks like white flour, but it's much better for you. And instead of buying canned soups that are loaded with sodium and ingredients that you can't even pronounce, try a homemade soup or a brand like Amy's that supports organic practices and low sodium and delicious and healthy. Some other ones are sugar. Sugar is really, really bad for you. It's I call it it's a legal drug, and it's awful for you. And it also destroys your good gut bacteria. So during this time that we're in, we want to make sure that we keep our gut, our second brain, as healthy as we can. And white sugar is no good. So if you want to have something sweet, try coconut sugar or monk fruit. So those are some things that are available. Even rice, instead of buying white rice, try wild rice. It's nutrient dense, much better for you. Brown rice, but if you're going to buy brown rice, make sure it's organic.
Okay.
My favorite one is turmeric. Turmeric is anti-inflammatory, antioxidant. It's good for your immune system. It's one of my favorites. I actually make wellness shots with turmeric. I use turmeric, ginger, lemon, apple. These are items that are available to most of us all over. And if you can't get fresh turmeric, buy dry turmeric and make sure you're getting it in your system every single day. Turmeric every day.
Yes, turmeric is so tasty. Not, but I do put it in my drinks. I put it in the morning when I'm doing the warm lemon, like
Yes.
the warm water. I put it in there, and I drink it.
Yeah.
And actually, it's the taste is not as adversarial as it was when I first started doing it.
And the
So-
important thing with turmeric is to make sure that you're using black pepper with it, because black pepper helps your body to absorb the curcumin in the turmeric by 2,000%. So if you're going to have turmeric, it has to be used in combination with healthy oil, healthy fat, not oil necessarily, but healthy fat, and black pepper. And that way you might absorb it properly. And at night, I mean, you're drinking it in the morning, that's excellent, but you can also make a drink at night. It's golden milk. Your choice of milk, I use non-dairy, and turmeric, black pepper. You can use date syrup, you can use honey, you can use maple syrup, cinnamon, cardamom, ginger, all those spices. Warm it up and have it as a night cake.
Excellent. All right, Kiana, anything you want to share as far as stress, how people can do anything you want to share to your community, to our community?
Hey, Sharon, we getting a lot of feedback from your mic.
Is it my mic? Okay.
Yeah.
Yes, I would like to share some simple steps that we can actually do. As I mentioned earlier, just get an adequate amount of rest. Just continuing to actually monitor yourself. Everything isn't, happens all at once. Sometimes it's just, little things that you can notice and, take note of it and almost keep a journal of your own health, of what's going on with your body. Because that's really important, not to wait till the last minute to get any type of help from the hospitals and, so that's one of the things I want to do. Also, smoking. I know I hate to say it, but that compromises the immune system. I know a lot of people deal with stress by smoking, but that also compromises the immune system. Even with drinking, if we throwing back, a 6-pack every day, we just going through things that compromise the immune system as well. If you're gonna drink in moderation, we're adults. I can't tell anybody what to do and what not to do. But drink in moderation and just be aware of what you're going through, how your body is responding to it, emotionally, mentally, and physically, because they all tie into it. It isn't a one, blanket solution. It all runs together and tie in how we, how our body responds and fight, whatever is trying to enter it. So it's just simple steps that we can take to try to stay healthy and keep those around us healthy.
Mm-hmm. Yes.
Great feedback. Thanks for that.
Yes, that was great information. Thank you.
Thank you. Okay, before we ask, let's go ahead into our hot seat question. If you want to weigh in. If you don't try to keep it under. This is the hard part. Try to keep it under 90 seconds because we're going to do a hard stop at 56 minutes. Thank you guys so much for sharing of your time. Those of you that are watching the video, thank you. Those of you who will watch it later, thanks so much. If you have questions, just send them to info@UCDI Leadership. Listen, we have to do what we can do to be aware, to be educated, to be safe, not just for us, but also that we can share that information with our community. We don't want to share faulty information, and we don't want to share hype or, something with an agenda to it. We want to share solid information that can improve chances and improve our livelihoods. So let's go ahead with the hot seat question. Protesters, what's going on?
So Sharon, we know that the First Amendment in our Constitution provides us the right to religion, speech, and also the right to assemble, right? We understand that. But we also understand that the broader picture is that we have a village. It's called the human village. And in the human village, we're responsible to do no harm to each other. So our healthcare workers on the front line, they're trying to do their very best with the tools provided for them. We, as a human village, need to do no harm by stopping them from doing their roles. Again, follow the science. I don't truly believe in my core that anyone is trying to strip away your constitutional right to assembly. They're trying to strip away the right for you to die before your time. So kudos to our frontline workers in healthcare and the restaurant industry, our cleaners, our sterilization reprocessors. Empower them to do their job so they can protect us all.
Yeah.
Absolutely.
Yeah.
Anyone else? Okay, then right before I take us out, I do want to say Kiana Williams is the author of The Golden Rose. Please go and check that book out. I'm going to put the link in the comment section. Please go and check it out. Also with Naima, I'll put Naima's, she's on Instagram. I'll put her information in the chat box as well. You can see it down there on the banner when she was speaking. Please go and visit her on Instagram if you have questions. I do know that she actually does like a brief complimentary consult, not a full-on, how can I get all of your expertise, but just, you know, if you want to kind of see where you are and see if this is something you want to invest more into, then please go to her Instagram page and check that out. Contact her. Other than that, how are you doing, Raven?
I'm good.
Raven, you're going to take us out of here. People are protesting, and people, I know that you know people who couldn't get the care that they needed, and people who you wasn't supposed to need care who actually succumbed to this and had no underlying conditions, you know, and it happened and it wasn't supposed to happen. So my heart is to bring awareness. I know all of our hearts are to bring awareness. I want you to take us out, but I want you to take us out telling people again why you believe they should be aware. So no pressure, but all eyes on you. No, just teasing, but no, just share your heart.
I just want everybody to know, like, you know, stay in the house. I know you're mad that you can't go to work and you can't make the money, but if you're not alive, once again, you can't make money. It's more people around you that are prone to getting anything than you would think. So just stay in the house, stay away from people. If you have to go out, make sure it's only because you need to go out. Like, cook in the house. We can go out to fast food restaurants later, but cook in the house. Yeah, everything's opening back up, but stay in. So.
Excellent. And I agree with that. Thank you guys so much for your time. My name is Sharon Combs. This is UCDI Leadership with Knowledge and Nonsense, and it's just nuts and bolts conversations where we look at something and say, is this knowledge or is this nonsense? Just because it's the loudest, just because you hear it the most, doesn't mean that it's knowledge. You know, just because you see it on social media or even TV, doesn't mean that it's accurate. And so here we just want to vet things and give people actual, sustainable, actionable steps that you can do that actually are based on knowledge. I said actual quite a few times there, but that's important. You want it to actually be knowledge and not just be like, I think such and such. No room for that right now. Look, get innovative, get innovative with these masks. I know they cute. I know it's your favorite team and you repping your school or whatever. Make sure your mask has a filter in it. And if you're wearing the same surgical mask that you had 30 days ago, you're in danger. You may not even catch COVID, but something else. There's a lot of stuff going on in there. So that's not the proper practice, okay? It's not the proper practice. Go in Home Depot and look at your air conditioned vent things. A lady at my church was telling me about that. And see, these things kill virus, and just make sure there's protection between you and your skin. There are some ways that you can be innovative. Don't only wait on somebody else to tell you what to do. All right, y'all be safe. God bless. Thanks so much for joining us. Naima, thanks so much for joining us. Kiona, thanks so much. Luane, Raven, Lila, I appreciate y'all sharing y'all Saturday morning. Hopefully we were able to answer some questions, and there are going to be so many more, which I may send to you guys because we have different sites and I couldn't pull all the questions. But y'all be safe. Have a great weekend. And thanks for joining. Talk to everyone later.
Thank you.
Bye.
Bye, everyone.
Bye.